Hey friends, do you remember that Friends episode where Joey got the kidney stone? I remember I was laughing my heart out while I was watching that scene. The way Joey was trying to push the kidney stone, and in the parallel scene, Phoebe Buffay was delivering her babies. It was all portrayed in such a funny way, isn't it? But in reality, kidney stones are nowhere near fun. If you have ever experienced pain of kidney stone in your life, I bet you would have vowed that day that you will do everything to avoid such painful situation ever in your life. But the question is, can you really avoid kidney stones in your life altogether? How are these kidney stones formed in the first place? And what can we do to prevent these nasty little stones being formed in the kidney? We have answers of all these questions here. Watch this video till the end and say goodbye to your kidney stone problems forever. Hello friends and welcome to your YouTube channel, My Expert Doctor. I am Dr. Shalini Singh Salunke, your consultant physician. According to data available, the risk of developing kidney stone is around 1 in every 10 male and 1 in every 35 female. But if you have already had an episode of kidney stone in the past, that would increase your risk of second episode by 30 to 35% over the next 5 years. That means if you have already suffered once, it becomes very important for you to understand what caused the formation of kidney stone in the first time, so that you can alter your lifestyle, your food habits, everything to avoid the recurrence of the stone again. So let's first understand what's a kidney stone. A kidney stone, also known as renal calculi or nephrolithiasis, is actually a hard deposit of minerals and salts which are formed inside the kidneys. Now let's understand how are they formed inside our kidneys. Our urine contains compounds like calcium, sodium, potassium, oxalate, uric acid and phosphates. When urine becomes too acidic or concentrated, those compounds come together and crystallizes. With passing time, it would stick together and increase in size to form a detectable stone. Stones are mostly of 4 types. Calcium oxalates and calcium phosphates, where calcium oxalate constitute around 80% of all stones formed, the most common type. The second variety is true white stone, which is actually a magnesium ammonium phosphate stones which are formed because of a urinary tract infection. It's a bit larger stone. Third variety is uric acid stone, which is formed because of the crystallization of uric acid, for example in patients with gouty arthritis. And the fourth variety is cystine stone, which is very rare form. It happens when cystine crystallizes and forms a stone. Usually it happens in genetic conditions like cystinuria, etc. How do they present in patients? How will you understand that you might be having kidney stones? So usually the first thing kidney patient will experience would be abdominal pain, which would be sharp, severe, probably located mostly in the side and back below the ribs, and may radiate to lower abdomen or groin depending on the location of the stone. This pain usually comes and goes, and intensity also fluctuates. Associated symptom would be urination. It might be painful or burning while passing urine. This would be with or without blood drops. The frequency of urination might increase, but each time while you are passing urine, the quantity might drop. This could be associated with symptoms like nausea, vomiting. All these symptoms sound so horrible, right? So now let's try and understand what provoke or promote formation of stones in our kidneys. What are the factors responsible for that? So the first and foremost is family history and personal history. If you have any family member who is a diagnosed case of kidney stone or renal stones, or if you have similar episodes in the past, then you are at a higher risk of getting a repeated stone episode. So you should check with your family members whether they have history of kidney stones issues, and if yes, then you should start taking precautionary steps. The second thing is dehydration, and this is one of the most common cause of kidney stones. Now we understand that concentrated urine promotes formation of kidney stones. But what causes concentrated urine? Dehydration, inadequate hydration status in your body. So watch for the signs of dehydration like dark colored urine, cracked lips, thirst, and keep your hydration status up and adequate, mostly with water. Remember, alcohol, coffee, tea doesn't count. So the third factor is dietary. That means high protein intake, excess of salt and sugar in your diet can up your risk of stone formation. It might sound a bit weird, but it is a reality, scientifically proven. So you must limit your intake of sugar and salt by choosing a healthy diet. Now, as far as protein intake is concerned, let me tell you, the daily requirement for protein for any individual is about 0.8 to 1 gram per kg body weight. That means if your body weight is 70 kg, then that means your daily protein requirement is only about 56 to 70 grams. And if you take more than that, it is not going to give you any additional health benefits. And on the flip side, it might increase your risk of stone formation. So don't overdo on your protein intake. Fourth in the list is obesity. Even a high BMI, large waist size has been linked to an increased risk of stone formation. Hence, losing those extra pounds or extra inches might help. Fifth in the list is digestive diseases and surgeries. Gastric bypass surgery, inflammatory bowel disease, chronic diarrhea can alter your absorption of calcium from the gut, which can increase your risk of stone formation. So unfortunately, if you have any such condition, just take some extra precautions around your diet and hydration. Sixth, the medical conditions like renal tubular acidosis, cystinuria, hyperparathyroidism, repeated urinary tract infection, type 2 diabetes, gout, kidney cyst, and osteoporosis can create problems for you. Seventh is certain supplements and medicines. Vitamin C supplements, dietary supplements, calcium-based antacids and laxatives, when taken in excess, thyroid diuretics, seizure meds, antibiotics like ciprofloxacin, ceftriaxones, these all can increase your risk of kidney stones. Here I want to specially mention calcium supplements when taken without adequate hydration, without any medical supervision, can actually increase your risk of kidney stone formation. So if you are taking any of the calcium supplements, always take it under medical supervision and keep your hydration status adequate with appropriate water intake. Anyways, if you ask me, I strongly condemn any kind of supplementation like dietary supplements, vitamin supplements or protein supplements without any doctor's consultation. Nowadays, I see many people buying and selling supplements like cookies and chips without any medical supervision. Friends, you need to understand, putting anything artificial into your body, into your system is neither cool nor okay. If you think you have any kind of deficiency, get it checked. And if at all you found that you are deficient, then try to correct it by natural ways. If that doesn't work, then go consult a doctor and take the supplementation in adequate dosage for adequate duration under medical supervision. I think I got sidetracked. Let's quickly revise what all precautionary steps you must take to avoid stone formation. Number 1, drink plenty of fluids, mostly water. Limit your foods with high oxalate content. The list of oxalate-rich food is shared with you on the screen. Have a look. Third is eat enough dietary calcium. Yes, dietary calcium is good with no risk of kidney stone. Fourth, avoid extra calcium supplementation. Fifth, eat a moderate amount of protein. Sixth, avoid high salt, sugar intake. Seventh, avoid high doses of vitamin C supplement. Eighth, try to achieve and maintain a healthy weight. So I hope you have understood what precautionary steps you must take to keep these little devils away from you. With similar healthy yet interesting information, we will see each other again. Till then, sayonara.